So you'll be talking to me, Dr. McCarty.
Okay. And we're going to tell them to quiet zone, or
Yeah,
I don't know if
if
they're...
I hear him, I'll tell. Dr. McCarty, can you tell me what were the symptoms that Raymond was having that indicated that he needed, and you need to tell the surgery what it was. What were the symptoms that you saw in Raymond?
Okay, I wasn't ready for that.
Yeah, I'm trying to go along with what they said.
Tell you what, we can rehearse it once, and then we can go and can do it. Well, he had chest pain or shortness.
They don't ever hear me.
Okay.
So when I first saw Raymond,
he had, well, no, because I have seen him before, so should I go back? But then he moved and he came back.
You can say Raymond's been when I first saw Raymond, I saw him years ago, and then you treated him for whatever you treated him for. And then a few years ago he had shortness of breath or whatever, and he needed, this surgery.
Okay. When I first saw Raymond, this was back a few years ago. Okay, let me just do it again. When I first saw Raymond, that was a few years ago, and he had a heart attack that I had to go in and do the angioplasty and stenting, and he did fine. Then he moved to Oregon, and where he had a few years later developed some shortness of breath, chest discomfort, and dizziness with his normal activities. And he was diagnosed of aortic stenosis, which was severe at that point in time, and that prompted us for the transcatheter aortic valve replacement therapy, or TAVR.
And what is the problem I got? I'm trying to remember. What is it that the problem that he had in layman's terms? Aortic stenosis, what is it?
Aortic stenosis is the tightness and the calcium deposit built up on the aortic valve, which is the main gateway from the left lower chamber of the heart, where the blood ejects through with oxygen and going through that aortic valve to the rest of the body, supplying blood and oxygen. Once the valve gets tight enough, there is no blood or oxygen then get through that, and that's when you call it aortic stenosis.
Okay, so the next thing I'll be looking for you to say, after discussing the procedure with his family, him and his family, they had decided to go through with the procedure. The procedure took approximately 2 hours. He stayed in the hospital for a couple days after that, and from then on he was ready to go.
Okay. So after he came to see me with aortic stenosis that was severely symptomatic, we had long discussions about the benefits, risks, and the alternatives of various treatment modalities, including medical management, open heart surgery, and doing the transcatheter aortic valve replacement, or TAVR, through the femoral access. The procedure was then performed at the hospital. It took us about an hour, hour and a half to do the procedure, and then Raymond was at the hospital for about, I would say, less than 48 hours, and he went home very stable and back to normal self within 3 to 4 days or so.
And can you describe Raymond's quality of life now, or then and now?
Raymond has always been very active despite his age. He volunteers at a hospital. His quality of life suffered just a tad bit with the severe aortic stenosis before we promptly diagnosed it and treated him. And now he's back to normal self. He lives by himself and still volunteers at the hospital. And
last question, being that Raymond was 102 or 101 when you did the procedure, did you have concerns with his age, or are you that confident in the procedure? So somehow I want to say, Raymond was 102. A lot of people would say, he was too old for surgery, but this is a safe.
Yeah.
So you might say his children were concerned with his age, or something like that.
Okay, yeah. I know that Raymond is over the age of 100 years old, and in our heart team conferences and talking to the family, there was a concern about the age, but the transcatheter aortic valve replacement, or TAVR, is such a neat procedure that confers 75% lower risk than open heart surgery. And with my training and skills and God's help, we were able to pull through in with him, and he did great with the procedure.
Good. Okay. So I think that'll work for him. Can you tell me, with Sherry, what were her symptoms and what was the procedure?
Well, I didn't do any procedures on Cherie. Yeah.
What did you do?
With Cherie?
The woman that was in
The woman. So that's his daughter. No, she had been treated at USC for clot in her legs and had some stents put in, and they were clogged up now. And then she came to me that, hey, can you help me? And I just referred her to a vascular surgeon. I haven't done any procedures on her, so I would.
So that couple, the second couple that was in.
Oh, second couple.
Robert.
No. Robert and Darlene. Yes, Darlene.
Okay. I don't forget.
Yeah, no worries.
Yeah. So can you tell me what were Darlene's symptoms and what was your diagnosis?
Okay. So Darlene had been our long-term patient as well, and over the course of the time, she developed a severe aortic stenosis with symptoms of chest pain, shortness of breath, and dizziness and heart failure. And she was placed on home oxygen because she was so short of breath. She was placed on home oxygen because she was so short of breath.
And what? So I'm trying to figure, because there was a real hard conversation with them, trying to figure out what to ask that fits with them. What was your recommendation to the family after that diagnosis?
After knowing that she had severe symptomatic aortic stenosis, which is a very lethal problem, and it kills more than 50% of the patients when they are diagnosed with severe aortic stenosis and heart failure within 1 to 2 years, our recommendations to get a valve replaced.
Okay. And so how long did her procedure take and how long was she in the hospital?
So after doing the workup and seeing the surgeons, it was determined by the heart team again that she will be a better suitable candidate for transcatheter aortic valve replacement, or TAVR. Her procedure lasted about, again, hour and a half to 2 hours, and she was in the hospital for about less than 48 hours and she went back home.
Okay, I'm going to have you say this, and you may not have been aware of it. Before she came in, she could barely walk.
Yes.
Because of breathing. When she left the hospital, she was able to get in her son's Jeep.
Yeah.
With no problem.
Yeah.
So,
okay. And before we had performed the TAVR, or transcatheter aortic valve replacement procedure on Darlene, she was hardly able to walk. 48 hours after, when she was being discharged, she actually walked to her son's Jeep by herself and got into the Jeep by herself. So it was immediate relief and recovery.
Good, because that fits with what he said. Okay. And how improved is Darlene's quality of life in your opinion?
Studies have shown that the transcatheter aortic valve replacement done through catheter approach improves the quality of life in all patients across the board, more than the open heart surgery. I see that in majority of my patients, including Darlene.
Okay, let's do it one more time. Yeah, a little pause in there.
Yeah. Studies have clearly shown that transcatheter aortic valve replacement improves quality of life in all the patients. And that was the case with Darlene as well, that she had a much better quality of life after the procedure.
Good. Let's go to Paul. You've treated Paul for 18 years. So you can kind of just go across the board.
Yeah.
So when you first saw Paul.
Yeah. I first saw Paul many, many years ago. I think we've been together for the last 15, 18 years now. Paul had a heart attack at that point in time. He had multiple arteries that were blocked. Consideration was bypass versus multivessel high-risk stenting. And we performed the high-risk stenting because he was not a good candidate for open heart bypass surgery at that point in time. And he has done very well over the course of last 18 years with us. And he's a great guy and great patient.
And because he had a lot to say, so I'm trying to think how to integrate what he said. When you first saw him, how many procedures have you done with him? Because he said he's had 8 surgeries?
When I first saw Paul, since we had to do multiple arteries, and when we do the angioplasty and stenting, we usually stage them because we want to fix a couple of arteries at one time and come back and do the third one at a later time. Over the course of the last 18 years, Paul has had multiple echocardiograms, stress tests, and some of the angiograms that he has had.
Okay, and maybe say because, so I guess what I want to say is, because Paul, in a sense, and I don't know how in your words, had this, the intelligence to continue to see you, he continues to have great health. So I want to say, Paul is one of the good patients that sees us regularly, and because he does, we're able to monitor him and provide him a high quality of life.
Yeah, my question really is that with Paul, I don't know if he mentioned that he had bladder cancer at that point in time, and
No,
that's
he didn't say
why.
anything about that.
Yeah, I don't want to say anything that he didn't say, so
Yeah, no.
I would.
And he was saying how long he's been with you and how great you were. So if you can say, to kind of encourage your patients to,